Hi, and welcome to FFRF's Ask an Atheist. I'm Dan Barker. I'm co-president of the Freedom from Religion Foundation. And I'm coming to you live from the Stephen Uhl Friendly Atheist Studio in Freethought Hall, which is the headquarters of the Freedom from Religion Foundation in Madison, Wisconsin.
I'm Mark Dan, FFRF's Director of Governmental Affairs based in Washington, D.C. Today on Ask an Atheist, the topic is Theology Off My Biology, Catholic Healthcare. Joining us is Evan Minton, who is denied critical health care from California's largest healthcare provider, Dignity Health, because he is a transgender man. Dignity Health is a Catholic healthcare provider, and we'll discuss with Evan about what happened to him, how his story caught the attention of members of Congress, and how he's fighting back. You can find Evan on Twitter at Evan M. Minton. And Evan, we're honored to have you with us today.
Thank you.
So during the show, this is a live show. If you're watching live and you have questions for Evan during today's show, or even for me or for Mark, you can ask the questions in the comments there on Facebook, or you can send us an email. Send it to askanatheist@ffrf.org. This show is called Ask an Atheist, but we also have a question for you, the viewer. Should the Catholic Church be allowed to operate hospitals? You can put your answer in the comments, and we'll try to read your answer over the air, provided that it's family friendly.
And remember, FFRF is a 501c3 nonpartisan organization, so we do not and cannot take sides in partisan elections and don't endorse any such views that might be expressed here. So Evan, let's talk a little bit about your story. Take us back in August 2016. You were undergoing gender-affirming care through a series of medical treatments. We understand that you made an appointment for treatment at Mercy's San Juan Medical Center, a hospital in the Dignity chain near Sacramento, California, close to where you live. And then what happened?
Yeah, no. So what happened was I first, not every trans person feels this way, but in my journey, I felt that in order to remain congruent in my body, and my body, has sent messages to me through how I feel, that medical intervention is needed in my transition. And so I've always had to keep up, mind, body, and soul through the course of my transition. And so at one point in my transition, I determined that I simply needed phalloplasty, which is the creation of a penis. Mm-hmm. And so I went to a phalloplasty surgeon, and as you can imagine, those are few and far between. And they gave me a checklist of things that I needed to do in order to get that surgery. And, there's a long checklist. It's electrolysis on one's whole arm, which takes about 80 hours. It's sign off by different doctors. And on that checklist was a hysterectomy. And it was funny because it's just like, you don't realize the significance of the surgeries until you're like looking at a checklist of 8 different things. And one of the things is a hysterectomy. So they told me in no uncertain terms that I needed to get this hysterectomy at least 3 months prior to the phalloplasty surgery. And one of the reasons was, it's really dangerous to go completely, under anesthesia, twice in a 3-month period. Mm-hmm. So my doctor at that time, my primary care physician, happened to be an OBGYN and, typically performed hysterectomies. And so she scheduled one at our neighborhood hospital that that she always performed at that was covered by my insurance. And so that happened to be the Dignity Health Hospital.
Right.
And so that's how we ended up there. It wasn't that I chose them. It was that would have been the one that I would typically have gone to. So as I was getting ready for this hysterectomy, it ended up being like hard. And I know that the show is Ask an Atheist, but I ended up, praying about it. It was hard because I knew that it was the right thing to do, but I also, it was like taking away the last vestiges of my womanhood, which was what I wanted, but it was just like, it was a very significant process for me. And so I had to go into this period of seclusion and get myself mentally, physically prepared. And 2 days, and so leading up to the surgery, I got the hospital socks, I got the intake package, I got everything. And 2 days before the hysterectomy was to take place, the nurse called me, and it was the typical, like, this is, this is the process. You check in at this time. This is the time the surgery takes place. This is the time that you need to be picked up. And at the end of the phone call, I just made a note and I said, hey, you know what? This is typically a woman-centered surgery. I just want you to know that I'm transgender and that I use he and him pronouns. If you can just make a note in your chart, that would be great. Pronouns are important to me and they're important to the transgender community. And she seemed very welcoming and affirming. And I thought, wow, like that's great. Like, and I hung up thinking, if I did a good thing for the trans community, just trying to educate one more person. And I thought, cause it's just like trans folks in healthcare, it's hard for us. And so I also felt like if this person was this affirming, then I was in good hands. Like I thought that I was going to be in a place where it was good hands. I'd never really heard of Dignity Health before. And so
Evan, Dignity Health is a Catholic healthcare provider. Is that right? A Catholic hospital?
Yeah. But it's just like thankfully had really no need to know about any of this stuff before it actually happened. And then, obviously I found out a great deal about all of these issues afterward.
So what happened? They turned you down?
Yeah. So I'm just getting to that part of the story right now. So the day before my surgery was to take place. And so that was one day after the pre-op nurse and I had that phone call. My doctor called me and she said, hey, Evan, are you sitting down? And I said, what? Why? And she said, are you by yourself? And I said, what? Why? These are questions you never want to hear from a doctor. And she said, I have to let you know that your surgery has been canceled. And I said, what? And she said, they won't let me perform on you. And I said, I thought you performed hysterectomies there all the time. And she said, I do. They won't let me perform on you because you are transgender. And at that point, all of this shame that I had to deal with with myself, like this internalized shame that I had grown up with, all of the struggles that I had encountered along my journey, all came crashing back to me at the same time. And I just fell down. I just collapsed, just hysterically crying. And because it meant two things. It meant that they were rejecting me solely because of who I am. And it also meant that all of my other medical procedures that I had lined up in order to really take care of my whole being were put into flux. And so that left me completely stranded and lost. And it was devastating for more than one reason.
Well, it's called Dignity Healthcare, but the irony is they don't seem to understand dignity.
Yeah. And so the following that like we tried to get them to change their mind, and my doctor said if my voice sounds hoarse, it's because I've been yelling at people all day. She's like, I went all the way up to the hospital president, and as it turns out, he said to her, he said, we won't serve Evan tomorrow, and we'll never serve him. And those words still, those words still are hurtful, and they burn, you know. And I worked in the legislature at the time, and was and still am well connected. And the frustrating part of it is that you shouldn't have to be. You shouldn't have to be well connected in order to get basic medical care. But legislators were calling into this hospital. My friend was the elected state constitutional insurance commissioner. He called in and argued for me. But we realized with even all of that they still weren't, they were listening to us at that point. They were finally returning our phone calls, but they weren't changing their mind. And so I had to go to the media. We had to put the private pressure wasn't enough. And so we had to put public pressure on them. And so I had to I'm so sorry. So I had to argue for my health care in the media. And I mean, and so it was obviously a desperate and undignified time. And if you can imagine how helpless anyone would feel in that circumstance.
Yeah. I mean, the idea that anyone, and I'm sure we can all think of just any medical procedure that we all need, just having to go to the media of what that was like. And can you talk a little bit about what that, you talked about how the news, you collapsed on the floor and this. Can you talk about some of what you were feeling and what you were thinking about, and what do you think this meant for the trans community? And I know this is a lot in that question, but tell us more about what you were going through, and what you were seeing during that time, because that's just, to get basic medical care is just so hurtful. And so talk more about that, if you can.
Yeah, well, before I leading up to this surgery, I took it so seriously. And I know that, this might not be a belief that you share, and that's fine with me. But I envisioned, and this is the first time that I ever envisioned it, but I envisioned like I don't know what I believe about an afterlife. But I envision like the relatives and the close people in my life who have passed on, and I envision them like around a campfire, and a place that I actually went to growing up, like a camping spot. And I just gave this over to them, and I said, put this, like, share some of this burden with me, and again, like, I'm not necessarily a religious person, but I envisioned this group being in my corner. And after this rejection happened, I collapsed on the floor. When I finally was able to get up, I got up. I was at my parents' house. I was by myself. I walked around their house. I had to feel along the walls because I was blinded by my tears. But I kept on saying to myself, this is happening for a reason. I don't know what the reason is. This is happening for a reason. I don't know what the reason is. And, perhaps I just keep on coming back to hope, like hope. And I've been struggling with hope lately. Like, hope can be good in certain circumstances, and it can be hard, in certain circumstances. But but I said, this is happening for a reason. I don't know what it is. And it's just like I threw myself in the shower, and I was just like, but it was so hard. And going on TV was, I call it the week of uncertainty, because it was just like I was on the phones with, I happened to be, as I said, trans people in healthcare, it's just really difficult. And so even though insurance should be covering our medical procedures by law and by regulation, they often don't. And so I already happened to have a legal aid attorney who I was working with, and so on an insurance coverage issue. And so all of a sudden she switched gears, and fought for me in this as well. And so that was who, was the main fighter for me and the main coordinator on this whole issue of, like the hospitals getting back to me, the hospitals communicating with me and stuff like that. And then Dignity Health, it was funny. In the first 48 hours of this, they changed their story about what happened and what their policy was 3 times, And in the whole course of this lawsuit and everything, I think they've changed their story about what happened and their policies 6 times. My story's never changed.
So Evan, I wanted to ask, Dignity Healthcare is a private health provider. And even if the insurance companies did cover this, can they force a private Catholic hospital to do a procedure they don't want to do? Did you take legal action?
Yeah, I did. I took legal action. And so I think that's the crux of the issue, is they were claiming, because in their it's called EIRs, and in their EIRs, they literally do not believe that transgender people exist. And so they consider this to be an elective surgery. I cannot for the life of me even, entertain that notion. They also believe that getting one's tubes tied is intrinsically evil. Obviously I'll just say it's safe to say that we don't see eye to eye.
Because of the Bible. It's because in the Bible it's male and female and that's it. And of course they're very pro-natalist and anti-abortion and in many cases anti-women's rights, anti-human rights.
Yeah.
So
yeah, they are definitely anti-abortion. They're anti, in some of the Dignity Health hospitals, as it turns out, they don't give the morning after pill to even rape survivors. And it's just, and so the landscape of hospitals in our nation is in a very precarious place.
So what did you do? What are you doing legally to proceed here?
So I was connected to, I was asked if I wanted to be connected to an ACLU attorney. And I said, sure, I was willing to have a conversation. And then the ACLU attorney, she told me that she cleared her desk when she saw what happened to me, and asked me, they asked me if I wanted to be the plaintiff in a court case. Mm-hmm. And I didn't know if this is after the hysterectomy, before my phalloplasty, that we had these conversations. And I took it really seriously. And I didn't know if I was strong enough to take on a court case, but I finally figured out, what is my responsibility to my community? And I finally figured out I'm strong enough to take the first step. Mm-hmm. I never, in my imagination, thought that it would go to the United States Supreme Court. But eventually it did.
So before we get to that, the court case, I definitely want to talk about what happened when the case landed at the Supreme Court. You did have some complications throughout your care. And can you tell us more about what happened there?
Oh, yeah. So one of those circumstances was I had a catheter, and I think this was between one of the surgeries, and in recovering from one of the surgeries, and it wouldn't stay in place, which, is a big problem.
Yeah.
And so I went to my nearest emergency room at the time. No, urgent care. I went to urgent care, and they told me that they don't handle issues of catheters, to go to the emergency room instead. And they pointed to the nearest emergency room, which was in the same parking lot.
Mm-hmm.
And it happened to be a Dignity Health hospital.
Mm-hmm.
And I thought to myself, there is no way I'm going there.
Mm-hmm.
And so instead, I chose to call my surgeon, ask the urgent care for a pair of scissors, and found the nearest public restroom, and had my surgeon on speakerphone and performed the procedure on myself.
Wow.
And then there was another circumstance of the pharmacist put the wrong pills in the right bottle, and it ended up being like, I was supposed to take 125 milligrams total,
Mm-hmm.
and it was 5 pills each. And then it actually ended up being one pill alone was 125 milligrams. And I took 5 of those because those were the instructions.
Right.
And I woke up the next day, and I couldn't really move, and I could barely speak. And I'm lucky that I was at my parents' house, and they were there, and they found me, and I said, I was able to make out the words, "Need to go to the hospital." And my dad put in his GPS, nearest emergency room, and it was a Dignity Health. And I said, "Not that." And so we had to drive farther away. And then, to convey the seriousness of the situation, they treated me as a stroke patient for a number of hours. And it's not just me. People are avoiding going to these hospitals because they don't fully recognize all of our population as full human beings. This gets worse in rural areas of our state and country. You were saying that this is the largest hospital provider in California. Well, it's like within the largest 5 in our nation.
Mm-hmm.
I'm not saying necessarily that these hospitals shouldn't exist. I'm saying that they should serve everyone if they do exist.
So can we get back to your case? Isn't it true that the Trump administration singled your case out and used you as an example of why Dignity needs a theological exemption, and why that theological exemption is more important than your very life? Isn't that true?
Yeah, that was difficult. Here I am, just struggling in this, kind of trying to deal with this court case, and just like the weight of that. And then the Trump administration weighs in, and they use me and 2 other transgender Americans as examples of why hospitals and doctors need to be protected against transgender Americans. And so, yeah, my name is like in the federal registry, and
Wow.
but I mean, it felt so hard to be singled out in that way, and obviously, like, I live in California, I'm progressive, and I would try to explain it to friends, because it's a federal regulation that's obviously incredibly harmful. Um, and, my friends, they're not paying attention to this stuff. And so they were like, oh, take it as a badge of honor if the Trump administration is singling you out. And it's just like, you're not getting it. You're not getting it, Yeah.
And I mean, and especially we're talking about healthcare, which is extraordinarily personal, let alone things that talking about care about who you are as a person and whatnot. And just the absolute invasion of privacy that happened to you is astounding and heartbreaking on so many levels of having to take extraordinary measures to get basic health care. And then, I mean, we've all had things we talked about earlier. We've all had procedures done. And the last thing any of us wants to be is on the news about it or in the Federal Register or have the president administration talking about it. And it's really, man, you must be carved out of iron. So we certainly tip our hat to you with that. And then kind of more on the story, your story got the attention from Congress. And you did testify in front of the House Oversight Committee in 2020. And so we do have a clip from Representative Ocasio-Cortez commenting a little bit about your story and the situation you're in, and talks a little bit about healthcare from a religious perspective, healthcare that is not delivered on what our patient needs, but what our theological needs and theological ideas. So let's roll the clip.
It's very difficult to sit here and listen to arguments in the long history of this country of using scripture and weaponizing and abusing scripture to justify bigotry. White supremacists have done it. Those who justified slavery did it. Those who fought against integration did it. And we're seeing it today.
So how did you feel Congress is discussing your issue? Was that, as you say, a matter of pride, or was that just, an embarrassment, or what?
No. That it was an honor to be invited to go and testify. And, that was when Trump was president, which are really hard words to say, but may that never happen again. And it was so weird, though, because, times have changed. And so, I guess nobody wants to be considered anti-LGBT, even though they are. And so, like, the Republicans were saying how great Trump was on LGBTQ issues. And, Ocasio-Cortez and I were just exchanging looks like, are you kidding? You've got to be kidding. And I think that that's part of what inspired her to speak out so movingly. But yeah, no, it was and it was also so refreshing because, I was trying to explain to the people around me how it felt to be singled out in this way. But then I went to Congress and everybody there was on it. They just they knew because they were already working on this issue. And so as I so often have been since this happened to me, putting a face to a name. And the Democrats couldn't have been more supportive, whether they were, tended to be more conservative Democrats in some way or, more progressive. It's like they all couldn't have been more supportive to me. And I appreciated the opportunity, to share my story.
Well, we feel the same way, Evan. I mean, this story is very emotional, very personal, very moving. And of course, we can't say we'll be praying for you, but we do say we're thinking in not just you, but this whole issue where theology seems to be trumping basic human dignity. There's a switch there. Do you have time to take a couple of questions from viewers?
Yeah, but do you mind if I share one more thing real quick?
Sure.
Go for it. Go.
There's this trans guy named Oliver Knight, and he went through something similar that I went through, being rejected for care out here in California by a hospital, a religious hospital. And this was after mine experience. And unfortunately, he was on the operating table when they discovered that he was trans, and they quit mid-operation, basically abandoned him, and or mid-prep, before, like at the prep of his operation, he had to take the tubes off of himself and find himself a ride home.
Wow.
So
Improvement. Wow.
Yeah.
Wow.
Yeah.
That seems
Yeah.
criminal. That seems like the hospital's engaged in criminal action there, doesn't it?
So I just want to lift his story up. And obviously, like, I knew that what happened to me was happening to so many other people, but it's like, I'm happy to have made, case law around this. I'm happy to have carved out, and Oliver went and pursued a lawsuit as well. I'm happy that we were able, that, my case was able to facilitate that, but it's just like, he has an even worse experience. There's others who have even worse experiences. And I always just want to lift that up.
Wow. Well, then we can watch that case as well. So if you do have questions for Evan today about this issue, especially as it relates to religion, you can put them there in the Facebook comments, or you can send us an email. We only have about 10 minutes left here, but send an email to askanatheist@ffrf.org. Evan, we do have a question from Nancy K., who asks, do you believe many of the requirements to get gender-affirming care that are in place are due to religion rather than to patient care?
I love that question. And I wish that I could give like the most well-informed answer, but I want to say that regardless, it's too restrictive. It's way too restrictive. I shouldn't have to get 2 letters from 2 different doctors saying that I need a hysterectomy. When, like, if other people don't have to get any letters from any doctors. And it's certainly from likely a puritanical origin of our society. It's likely one of the examples of, when abortion was mostly in midwives' care, and then doctors, wanted to take it over and make it in a medical setting. Something having to do with that, related to that. But whatever the case is, it's too restrictive and it isn't working for us.
Right.
Here's a question from Timothy F. Were you surprised by how supportive your connections in the media and the legal sphere have been to getting the care that you need?
No. Grateful, but I'm also considered the first openly trans person who ever worked at the California State Capitol, and I instinctively but also jokingly call it the best of times and the worst of times. I knew that I transitioned genders there also, and I knew that it was going to be a public process, and I knew, because it's just like, it's a public getting facial hair and changing one's name and voice, people are going to notice. And so I decided that I wanted to control my narrative. And in order to do that, I needed to try to control my story. And so people started, I did that on social media. People started paying attention, and that garnered people's support. So I'm incredibly grateful for that. But people knew who I was, and people were supporting me. And although I encountered, plenty of pushback and harassment at the same time, it's like I knew that I had people in my corner. And that's another thing that one shouldn't have to have in order to get basic healthcare.
Yeah.
But on a personal level, I've just been incredibly, incredibly grateful for what I have.
But doesn't it show, the support that you're getting all the way from Sacramento to members of the U.S. House of Representatives, doesn't it show others who are in your situation that support is there? Yeah.
And that's what I've been trying to build, ever since, and I credit, Laverne Cox, Janet Mock, and well before that, it's just, trans people, Sylvia Rivera, generations of trans people have made sure to try to, fight for our space at the table and visibility and, through all sorts of circumstances. And, I think each of us, so many of us, try in whatever corners of the world that we're in to do the same. And that's why when I was deciding to take on this court case, I thought to myself, I'm a highly privileged person in a community that is incredibly marginalized. And that was part of my responsibility for taking this on. Mm-hmm. But it's just like, our community continues to push forward, and that has created our allies. And, it takes all of us in order to get the treatment that we need in our society, which is now under tremendous threat.
So, our organization, Evan, fights for the separation of religion and government. Do you think free thinkers, do you think everybody should be concerned about the separation of religion and healthcare?
Yeah, the thing is healthcare is in such a precarious state because hospitals are severely underfunded. And so they're being taken over by religious entities and by private equity firms. And what that is looking like is what's not okay. So for the private equity firms, whatever is not profitable is being chopped off. They're no longer providing those services. And so that is gender affirming care, and that is reproductive health care. And then for religious purposes, depending on the hospital, they're not offering those services. And so, we're getting this lack of care. And as a result, in California alone, 1 in 6 hospital beds, an average of 1 in 6 hospital beds is restricted care. It's restricted to the LGBTQ community, and it's restricted to services provided to those who have a uterus, like birth control, abortion, stuff like that. And so we should be very concerned about both private equity firms taking over our hospitals and the strict Catholic, religious doctrine that is governing, so many of our hospitals as well. Those should not be infringing on our need to access healthcare.
Well, thank you, Evan, for being with us today. What a fascinating story. What a gripping story. And, we just want to appreciate you for being on today's show with us.
Yeah, no, thank you for caring about this issue. And as we continue to be under attack, healthcare is under attack throughout our country, transgender healthcare. If I can just ask everybody to be paying attention to it. Mm-hmm. Now's a time where we need our allies and we need people to know that your issues affect our issues affect your issues. And so, just continue to work with us.
Well, maybe I can say amen to that. Well, that concludes our Ask an Atheist show for this week. We also have a TV show that broadcasts on a number of markets around the country. It's called Free Thought Matters. And this week on Free Thought Matters, our guest is Andrew Seidel. He's an expert on white Christian nationalism, and he's the author of the new book. His second book is called American Crusade. The show airs Sunday, but here's a quick sneak preview.
This is what I mean when I write that the Supreme Court is weaponizing religious freedom. Because religious freedom has always meant that we were protected from government overreach. It has never, ever, in the history of our country, been a license to violate somebody else's rights, to harm another person, or to impose your religion on them. And that is precisely what we are seeing changing. Instead of being about government overreach, it's about a tool, a weapon, a license to impose that religion on other people. And that is the big change that we've seen in the last decade in front of this court. That's the crusade that I'm warning about.
That's Andrew Seidel. You can watch that Free Thought Matters show on TV stations all across the U.S. and also on FFRS Facebook and YouTube channels.
Plus, and don't miss Free Thought Radio. You can find out how to hear Free Thought Radio at ffrf.org/radio. If you want more information about the Freedom from Religion Foundation, check out our website at ffrf.org. If you're a member already, thank you. If not, please join us. And we'll see you next week on FFRF's Ask an Atheist.